Doctors of Reddit. What is the worst case of someone faking an illness you have ever witnessed? Right before my shift was over, I get an admit of a 9-year-old boy with new onset seizures. He and dad get settled into his room and we start hooking up electrodes to his head for an EEG. I explain that we are also video recording so any suspected seizure activity will be seen, along with data from the EEG. I then ask if they have had dinner yet, as kitchen is closing in 5 minutes. The boy asks for chicken nuggets with barbecue sauce, fries, apple sauce and chocolate milk. I call down to the kitchen to order his meal when the EEG tech says she is finished and we are recording. On cue, he begins to have a seizure. I stare, dumbfounded, as do the EEG tech and nurse assistant. The father yells he's having one now, in a total panic, not realizing there is no way this is a real seizure. The closest comparison would be as if this boy was doing the dance move from the ADS called the worm, but lying on his back while doing it. My co-workers and I are trying to hold back laughter, desperately not looking at each other. And I continue to order chicken nuggets, apple sauce and chocolate milk. From mid-seizure this kid yells, "Don't forget the barbecue sauce." That was it. I left quickly and hid in the bathroom laughing my ass off. Not a doctor, but when I broke my ankle I had to go to the ER, which was inconveniently very busy, filled with sick kids as well as a bunch of other people. I was already checked in and sitting in the overflow waiting room when this lady with 2 kids comes in. She immediately looks at all the people waiting and huffs loudly before storming up to the counter. She tells the nurse that her baby, the kid looked to be like 10, has the flu. Of course the nurse tells her that it'll be a bit of a wait and directs her to sit in one of the free chairs. The lady huffs again and tells the nurse that they need to see a doctor now. The nurse once again tells her to wait and that a couple just came in from a bad car wreck. She is not happy about this, so she lets go of her children's hands and pushes them to the side before she squats down on the floor. The nurse gets confused and stands up from her desk to watch the lady. And I'm watching because I'm nosy and my ankle hurts. I kid you not. This lady straight up sits in the floor of the waiting room and slowly lowered herself onto her back. Of course the nurse asks what she's doing and the lady responds, "I'm seizing," before closing her eyes and shaking her legs a little. I almost cried while trying to suppress my laughter. This lady is just laying on the floor wiggling like a weird worm, pausing to tell the nurse that she's having a seizure. She was escorted out by 3 security officers. Had a dog come in once with intermittent lameness of the left hind limb. Had been going on for months and seemed to resolve only to pop up over and over. It wasn't a mild lameness either. The dog would be barely toe touching at times. Absolutely nothing wrong on physical exam. No neuro issues. Radiographs showed jack squat. I eventually sent the dog out for an orthopedic referral and they couldn't find anything specific. They assumed the dog was somehow just repeatedly injuring itself at home when the owner was away. The owner installed CCTV at home to watch the dog and try and figure out what was causing the trauma, only to discover that the dog would happily tear around the house on all 4 legs during the day, only to start limping the second the owner came home. As far as we could surmise, the dog must have actually injured itself at one point, and realized that limping got it more attention and treats. Between diagnostics and specialist referral, the owner spent over $2,000 just to find out her dog was faking. Had a patient who was faking an idiopathic bilateral lower extremity paresis, think extreme leg weakness. Turns out he was trying to miss a court date for child/spousal support. His story and physical presentation was inconsistent. Without going into needless details, the final straw was attempting to throw himself to the ground while testing ambulation with a walker. That is why we use gait belts, so I could catch him. He complained because I foiled his devious plan to blame a fall on worsening symptoms. This happened while I was an intern. The truth is most of my patients are honest. Often confused. Sometimes scared. In my career this is the only blatant attempt of faking I've encountered. Exaggerated symptoms are another matter entirely. Everyone in my hospital knows the story of the patient who was under the infectious diseases unit. He had a horrible foot ulcer that would not heal. Despite every antibiotic the team threw at him. He was on 4 different antibiotics simultaneously at this point, including being hooked up to a drip with a very strong broad-spectrum antibiotic called Piptaz. His wound swabs kept growing strange and unusual bacteria. And he had been in hospital for months. They couldn't quite figure it out. Until a nurse caught him in the bathroom while she was doing medication rounds. He had taken down the dressings and was rubbing his own faces into the wound. Not a doctor but work in an ICU. We had a PT that was faking seizures. It wasn't why she was there. But it was making things a lot more difficult. When the shift started and the intensivist was rounding on her PTS. She gets report from the nurse that the PT is having pseudo-seizures. I'm not a nurse. But I'm told that pseudo-seizures is usually just code for fake seizures. The PT immediately starts thrashing around on the bed. The doc rolls her eyes. Pokes her head in the door. And says calmly, "You all right in there?" The PT responds, I am having a SEI Zuri a and doc says, "Okay. We'll keep an eye on that." And moves on. Had a diabetic patient who used to inject himself with insulin in the waiting room. Then we would have to run out there with a gurney and a few techs. Throw him on. And race him back into the ER to get some glucose into him. He liked the attention and to skip the line. A few times he would be looking right at the girl's working intake. Stare right in the eyes. And inject himself. I was not there the one day he took it too far. But it really sucked. I once met a physician who faked Asperger's syndrome so he could justify being an asshole without a second glance. A woman badly faked seizures. She had apparently convinced someone in the past, so it was in the EMR. At one point I questioned out loud whether she actually had seizures and she started shaking more violently as if on cue. Her seizures would stop as soon as the nurse stated that the Ativan was pushed, but before she the chance to flush the line. Most of the drug would have been stuck in the 4-tube at the time and not actually administered. Patient here. It was my second time into a psych ward. Now the only way you get in is if you are one cry away from grabbing a gun or the police haul you in. This lady was already there when I was checked in. Now, I have no idea what was wrong with her because she never said it. Not even during group. Instead she would complain about the food. The movies. The activities. She never talked to any of the trained therapists or anything. I mean, these people are great. They will go out of their way to make sure you feel comfortable with them, and they will stop what they are doing if you need help. One night she threw a fit because she couldn't take her medicine unless she had sweet tea. Water was gross. The Kool-Aid was too bitter and she refused to add sugar to her Kool-Aid. They finally struck a deal with milk. She was at least in her 70s. They let her go as soon as they could because if she wouldn't let them help her, then she didn't need to be there. She complained the whole way out the door, saying that they refused to help her. She also tried to get me put in a mental hospital. Someone came in for drugs with fake documents that basically had every sickness that could be treated with lean, and he tried to sue us for letting him acquire the drugs. My 10-year-old daughter fooled 3 eye doctors and got herself a pair of incredibly strong and expensive reading glasses, only to break down a few days after saying she wanted glasses so bad. God damn it. There's a mean trick you can do when you suspect someone is not really having a seizure. They'll be lying flat acting unconscious, and won't respond to voice or when you shake them. You raise their arm way above their head. Then drop it down so that it will land on their face. Someone who is not really having a seizure will often move their arm away as it lands to avoid being smacked, while somebody who is truly unconscious just gets smacked in the face. It's important to determine if someone is having a true seizure or not to minimize unnecessary radiation from CT scans, etc.